Facebook. Live on Instagram. Yeah, live on Instagram, live on Facebook. All right. I think TikTok's coming online here. You guys give me 1 second. I'm waiting for everybody to get in. All right. Eden, how you doing? Rosa, how you doing? Kid Wiz. Rod, big Rod. Michael Hearn said, pop the top. Should I pop the top? Mike, you really want me to pop the top on here? You tell me, yeah, I'll pop it. I don't care. Big Rod, man, with you, brother. I hope all is well. Hope you're feeling all right. Let me know. I definitely got some stuff for you, too, as well, in-house. So, 5, Jabe. Girls, what's going on? Cassia, what's going on? How you doing? Brian, how you doing? What's going on, all you guys? Welcome. I'm just officially making sure everybody's online so we can do this. All right, pop the top. So Michael Hearn said pop the top. So let me make sure Let me make sure Instagram and Instagram and Facebook are online. Let's see. Is TikTok up? Hold on. TikTok's almost up, Mike. If I'm going to do it, I might as well have everybody on here to show, right? All right, here we go. Let's see what's up. I don't see it yet. Am I on TikTok?
Yep.
All right, pop the top. Let's see what's up. I don't know. Brian, you might have to adjust that camera for him real quick.
All right, yeah, no problem.
Let's see what we got here. Got. I don't even know. I can't even see on TikTok. You guys are like, what's going on here? Not too bad, not too bad. A little size, cut up. Side profile, what about the back? All right, one more. It's time for the show. Let's go. All right. Pop the top for you. Michael heard us pop the top. I'm definitely popping it for sure. Next time you're down here, we're going to see what's up, dude. Next photo shoot's going to be ridiculous. All right. That's a tight lifestyle, baby. That's what it's all about. All right. Being able to pop your shirt off. You know, me and Mike talk about this all the time. You know, and I'm sure you guys can relate out there if you are a guy or even girls, right? When we talk about summer's coming and we talk about summer bodies and getting ready for summer and all this good stuff. You know, some people are like, you know, they think in their mind they could never get to the point where guys, especially like, I can't go to the beach. I don't want to go to the beach or pool. Or if I do, I'm going to wear a shirt the whole time. And they get in the pool with their shirts and all this and like, because they're embarrassed. I understand. I definitely understand. But at that point, that should motivate you to want to do something about it, right? Not just accept this. I'm just going to lay down and accept this. No, I'm definitely not. Me as that type of person, I'm definitely not one of those type of people. I know Rod's on here. He's not that type. I know Michael Hearn is definitely not for sure. 1,000,000%. Thanks, YG. I appreciate it. But, you know, I mean, at that point, even females, right, covering up their areas. Now, there's a lot more brazen people than I think there ever were before because, you know, before listen, when I was growing up, you know, there was majority of people were thin or of decent weight, healthy weight, right? And now it's like that's the minority of the classes inside the schools and stuff. Even in colleges, I mean, it gets every worse. And then you talk about jobs. I mean, man, you go into some jobs, you see them. Like I was at I was at my nephew, his little VPK graduation. And it brought me to it was like an enlightenment type situation where I was sitting there. I was looking at the stage, and I seen 4 20 to 30-year-old VPK teachers, right? And they were either really overweight or even some of them morbidly obese to a certain extent, right? And they're very young. And these girls probably don't make a lot of money. So, you know, I mean, they probably would really benefit from some of these different programs, which I'm going to incorporate. I'm going to start highlighting. A profession every month that's of essential need to our world, right? Like first responders or even teachers. I'm just going to go out. I'm going to highlight one of these people every month, and I'm going to give discounts to that profession if you can prove you're in that profession. So at that point, I can help everybody. I want to help as many people as possible. And if I can discount some things and highlight some of these different areas and make them seem how or show people how important they really are to the fabric of our country. I mean, think about our teachers. I mean, think about the standard of what your child is getting taught nowadays. I mean, I think about it, and I've sat in classrooms. So I actually went through a full day of school, not this year, but last year with Peter, to see what the hell was going on in school. I wanted to know. And you know what? The principal and the teachers actually thanked me. They're like, there's been no other parent that has sat in on one of our classes the whole day, especially. So I thought they were going to be upset about it, but they weren't upset, and they were like, listen, like we appreciate that a parent cares, because, you know, nowadays parents don't care, and that's kind of where we get a lot of unstructured, undisciplined young people or kids from. And then this is going to just tirade on until we're really old, my age, and these guys are controlling the country and they're just going crazy. So it's kind of crazy. All right, YG Lee said, I saw your story the other day about FSH injections. Am I able to get it at my age? Good question. You should be able to get it at your age. I mean, that's up to the provider, but I don't see why not. Now, are you trying to have kids? I mean, that's like one of the main functions for our FSH. And if you guys don't know what our FSH is, it means follicle stimulating hormone. And follicle stimulating hormone ignites everything in the body, right? And when we ignite this could raise testosterone levels in conjunction with raising sperm levels. So at that point, that's what our testicles do as us guys. And ovaries as females. It produces your testosterone level and controls that. Now, obviously, females don't have sperm, but males have that, and that's the other effect. So FSH is available for people out there that are trying to go down the fertility rate, that don't want to spend an arm and a leg at a fertility clinic for the same medications. So we do offer this and HCG for our patients out there, plus enclomiphene. That would be at the bottom of the totem pole. If somebody said, hey, listen, I want to take a real good shot at it, in my opinion, I would probably go with HCG or FSH. FSH is probably one of your most powerful ones that you can utilize. And we've had so much success with so many different patients being able to get their spouse pregnant. And I know one guy, and at that point, he was on testosterone for over 37 years or something like that. And he was really worried about it. We did sperm analysis on him, which we can run, and sperm analysis came back like no movement, no mobility, all this good stuff. And we started putting him on these protocols. And at that point, we finally got him, to have pregnancy. And then after that, boom, he had another kid a couple years later. So he has more kids than me. And I had, my kid when I was 28 years old. So, and he's well into his 50s now. So it's kind of crazy how that all works out. Do you know how long the injections take to work? So FSH, obviously when you start injecting these things, they usually work right away, like, within a week or two. That's when you start really seeing these things start doing that. Fitness for Life said, do you prescribe T4? Only if you need it. Like, we're not prescribing it for weight loss or anything like that. Like, if you need a medication for the thyroid, we're really, really conservative about it, and we want to make sure that you're good. So many people I've seen take different thyroid medications to lose weight or cut up, whether they're competing or some trainer told them to do it. And at that point, like, it's just a bad road to go down if you are doing this. I know you, I don't care, whatever, I'll do what I want. It's not affecting me. Well, I'm telling you, it could, and if it does, it will affect you for the rest of your life in so many different ways. So be smart about what you're doing if you're going to do things like that. But if you want to get monitored the right way and do things the right way and live optimally, that's what we're here for at Titan Medical Center. And we service nationwide with everything from hormone replacement therapy, medical weight loss, vitamin amino acid injectable therapies, rejuvenation detox, libido enhancers, peptides, and blood work, all nationwide. And I'm here to answer all your questions about anything like that, any therapies, any goal you're trying to reach, anything worth some substance. Let's talk. All right, so one question on here is, one thing said, nice vibes. That's awesome. And the other one was like, do you do more than 200 milligrams of test? So myself, I do 300 milligrams. Here at the clinic, it really just depends on you, your numbers, your health history, all that good stuff. The medical provider takes into consideration and brings together your personal regimen. And that could be 150 milligrams, that could be 200 milligrams, it could be 250, 300. It really is up to the provider and the patient as far as that goes with all the information that they have. So, they'll come up with what it is. Barbarian, what's going on, my man? I hope all is well, brother. You're killing on Instagram today. Jesus. All right, so we're getting it in. All right, so 2 wheels down. Keep the questions coming. Been on test for over a year. Recently, my sperm became very thick. My best guess would be testes are shut down. This could be the story. Now, question, are you taking an add-back therapy? At that point, and what I mean by add-back therapy, like when you come to Titan Medical Center, we're going to give you all the medications to basically minimize or get rid of any side effects that could possibly happen. And the side effects could be like high estrogen levels, so we got given aromatase inhibitor for that, and then your testicles shrinking, right? And then, your natural production getting shut off, sperm count going down. So at that point, we give the add-back therapy to make sure the testes still running so that you're producing sperm. So if you want to have kids, you can have kids. Now, if you take testosterone and your sperm function goes down, it doesn't mean you're going to become infertile. You just will have to reboot back up. So at that point, that's kind of where it's at, so let me know, are you taking something like HCG and clomiphene, kisspeptin, one of those, and is it coming from a real life pharmacy, and, are you getting monitored properly? That's the next thing to go hand in hand with. What do we got here? Barbarian said, all is well, brother. Definitely will hit you up when I'm head out to Tampa. 1,000,000%, dude. 1,000,000%. Barbarian, I love that, dude. So Barbarian is an awesome dude, guys. You guys will see him. I don't know. He's all over the place. All the different fitness events. Olympia, he'll be there for sure. I can't wait to see you out there. And he's got a great physique, and he does it by vegan, which I'm not a vegan guy. Everybody knows that. But I can respect that, right? Like, because he can do it, and it's all about, if it's somebody that's telling me, like I see some vegans and they're like these skinny, toothpick-looking guys that look very deficient in a lot of different things. And they're like, oh, I'm a vegan. Well, I don't want to look like that. A barbarian? Oh, damn. I'm like, what are you doing? He's like, So I'm like, damn. I'm like, I can respect that. So that's awesome. YG Lee, do you know what native testosterone is? Native testosterone? I mean, I guess that would be your testosterone that your body produces. Is it native to you? I've really never heard native testosterone. Let me know what that is. I don't take anything, just tests. I can reach out for HCG or FSH. So I would definitely do that if that's the key, right? Because what's going to happen is even if you test like LH and FSH, it's going to be like down. It's going to be downtrended if not shut down. So that's the only thing. And that'll tell you right away, what it is. But if you're not taking anything like that for add-back therapy, then natural production is pretty much shut down. And everything that's going along with it, probably going along with it. So, but, if you're on testosterone, you're not worried about fertility and stuff like that, then, that might be working for you. Johnny, you look good. Thank you. I appreciate it. So, I've been dressing up a lot more coming back in the office. When I started Titan Medical Center, even before that, I dressed up almost every day. So, it was something that I need to come back to. I like being comfortable and being able to work out when I want to. I have to change clothes to do that now. And it's so hard for me to get trained in that it's like sporadic. Like, when am I going to go? Hurry up. I feel like Superman running to the... if you guys remember these telephone booths and changing in there and flying out. It's pretty crazy. Barbarian said, our indigenous culture belief to not harm animals. I'm not a hippie, but I love to train hard. I know you do, dude, for sure. Like I said, that's cool. So that's along with his culture. He's Native American. Super cool, super awesome. Definitely respect for sure, 1,000,000%. All right, so let's go. You guys got any questions? If not, I got some things to talk about here. The CT Rock, what's going on? I hope all is well. If you guys want to talk about building lean mass, losing weight, what do you guys train, in the gym? What's your training regimen look like? People ask me that all the time. Like, what's your protocol program, as far as in the gym? And, it's a lot harder for me now, I guess, than when it used to be back in the day. Not as I had more time back in the day, I guess. I mean, or I don't know. I just did. I don't know. And I could be in the gym for 2 hours. I used to train a body part an hour per piece. I got a lot of good size out of it, a lot of good strength out of it, and stuff like that. Now, it's training, 3 days a week, and maybe 4, hopefully. but at least 3, and then doing, 2 body parts per day, an hour a piece. So 3 hours a week, maybe 4 with a little bit of basketball, cardiovascular and stuff like that too. So, chest and back one day, bis and tris the next day, shoulders and legs the day afterwards. And on all 3 of those days, I'll incorporate a couple core exercises to make sure you got to keep those abs. We got to get them. And then if you need cardiovascular training, that's totally up to you guys. I do mine my way playing basketball, so that's awesome. Well, that's what it looks like. I don't know what you guys look like. Are you offering the new Kaiser oral test on Decanate? So, yes, we started looking at it, and we're looking at what the protocol would look like for a patient, make sure they line up, because with this, right, they're still going to convert into estrogen, and we just don't know how fast, how much they're going to need. So what we're trying to do is I've got a couple older patients that have been with the practice for a long time that might want, there's always some that say, hey, listen, if you got something new, I want to try it. I want to see what's up. So this might be the way that I check it out with them, and then myself too as well. What's going on, CT Rock? I hope all is well, bro. All right, so next one. Let's talk about this. This is really cool. So I'm always reading the newspapers or online news, and I'm like, something that I can bring to you guys as a topic to talk about that has essentially some benefit to you guys. And this is something that I think that benefits more than a couple ways, right? And we're talking about Ozempic. So the drug maker Novo Nordisk says it will study drug effects on alcohol consumption but isn't focused on addiction. That's what the headline reads. But what they found is that people that started taking semaglutide, GLP-1s, even tirzepatide and all the ones that have GLP-1s in them, they're starting to see that people's cravings are starting to dissipate, starting to go away. So when they started talking about this, they started seeing people that usually drink alcohol didn't want to drink alcohol as much or didn't want to drink it at all. They didn't want to smoke cigarettes or anything else, vape or whatever it is. Sugar cravings, obviously these started cutting away too as well. So, with this, what comes? Better health, right? Cutting down smoking, cutting down drinking is the best, right? So if you can do that, now it's okay to have a couple of drinks here or there. If you want to smoke a cigar here or there, but constantly or consistently all the time is no good. So if you can take that away, you're going to be even more healthier. Now, let's not forget about GLP-1s, protecting cardiovascular health or helping cardiovascular health. So that's another big benefit just from this weight loss drug, which was stemmed from a type 2 diabetes drug. Think about that. And the main role play in the GLP-1 originally was for glucose management, to dissipate, to control hemoglobin A1C, make it right? So your sugar levels, so glucose levels inside the system are not high, because we know with high glucose levels or sugar levels, cellular deterioration happens throughout the body. So we don't want that. Nubiak said, no events for Titan and Memorial Weekend. So it's going to be a family weekend. Me, Charisse, Peter, and we're going to head out and go to the beach for a couple of days. So we decided that we were not going to do any events for Memorial Day. I don't know what to say. Raphael, I'm amazing. I appreciate that. Thank you, guys. But yeah, so that's it for the weekend. We're just not going to do any one. But so when you're taking Ozempic or semaglutides, GLP-1s, think about not just weight loss to benefit, other benefits that you might be able to get. You deserve a vacation with your family, definitely. I just want to spend time with my son, with Charisse. That's the biggest thing. I do all this. Obviously, I want to be successful and everything, but I do it for my family. So, I want to make sure that my son knows that and everything out there. So that's what it's all about. So I hope you guys are going to have a good Memorial Day weekend too, as well. I don't know what you guys have planned, but whatever you're doing, be active. Get with your friends. Get with your family. If you don't have any, go do something and be active with other people. There's plenty of different groups, clubs, things you can join if you're by yourself, that you can be around other people that want to have healthy athletic time. And that can be in a number of different ways, from roller skating to playing basketball to running to hiking, anything, weightlifting. Come on, just do it, right? Do it. Be active for yourself. Who is Brian said, I saw live with Mike. Does AOD prevent protein intake at all? So no, it's not going to prevent protein intake. So you'll be good with that. Raja Michael, best GH peptides that won't make you very hungry. Tesamorelin. Tesamorelin is definitely the GHRH, the growth hormone peptide that you're looking for. It's not like MK677 where it's going to make you hungry. And it has another different benefit, not just raising growth hormone levels, but targeting visceral fat, so belly fat. And it's FDA approved for this. So this is a beautiful thing, right? And it works very well. So if you're looking for it, that's the one, Raj. That is definitely going to be the one for you. All right. So GLP-1s we talked about. Therapy of the week is NAD. NAD, if you guys have not heard about this, is great for brain function. It's great for, energy production. It's good for cutting down or helping cells rejuvenate themselves. It's so good. It helps you every single day if you use it. Now, there's a lot of places that push it IV-wise. But you got to sit there in a chair for an hour and a half to 2 hours. Not to say it isn't good to do maybe every once in a while. But if you really want to get the effects of NAD and use it consistently and use it when you want to, you can do it by a small little injection with an insulin needle. It's very simple, very easy, and you get the benefits that day, right then, right there, ready to go. And there's a special on it, $25 off NAD. So if you guys want NAD therapy or you've had it in the past, take advantage of the discount. Get it while you can. Also, Memorial Day weekend special. We're going to do blood work for everybody. The blood work has been the biggest thing. I like to give the blood work special away, especially because it helps people find out what's going on inside. It lets them read inside their body to tell you what may be causing them issues, problems that they could probably take care of. So at that point, blood work is definitely the way to go for that, all right? What about combining with Semarelin? So you could combine it with Semarelin, but Tesamorelin is its own beast, dude. You don't need Semarelin. Not with Tesamorelin, I promise you. Way better. Way, way better. So yeah, that's awesome. Big shout out to Dan Wheeler in the house. I appreciate you, bro. Hope all is well. And yeah, so if you guys got any more questions, shoot them out to me. If not, I think next Titan event is June 15th at the Eagles Country Club. It'll be the Mother's 5th Annual Golf Tournament presented by title sponsor, Titan Medical Center. We're going to be out there with golf carts, Titan nets, free B12 shots, all kinds of giveaways, shirts, bags, you name it. And we're going to be out there having a great time. You don't have to even golf. We're going to have I think we have 2 clubhouses that are going to be open. They're just going to be people just having a good time, networking, talking with some people that are like-minded. So come out and join us for that. That's going to be awesome. Do I ever come down to Miami? So I do come down to Miami. I come down there every so often. It is what it is. When some of my people that live down there, they give me a call. Some of the bigger weekends like Art Basel or something like that, usually we go down. But yeah, I'll be there in the June event. Oh, nice. Nubia, you're going to love that event. It's going to be awesome. Rod, coming to the office next week before surgery. See you guys. Definitely come in. I got a jumpsuit for you. I got some other stuff for you. And I want to be on that track with you, man, to help you recover as fast as possible. Big shout out to Rod, OG Titan, with me. He knew me before Titan Medical Center. I give a big shout out to Rod. I love him much like a brother. So he's definitely with me, man. So give Big Rod all your love, all your support, all your prayers. He's going to have a surgery next week. And he's going to be back together, rocking and rolling with you guys very soon afterwards. So I think that's it, guys. I appreciate you guys all tuning in. Titan Talk Tuesdays with me, John, CEO of Titan Medical Center. I'm going to shout out to Big Lenny and the Delray Misfits. Okay, big shout out to him too. So I'll see you guys next Tuesday. I usually go on at 6 o'clock. I went on early today. So I was just like, you know what? I was at the office. I'm like, I might as well get it in a little earlier for you guys. I appreciate all you guys. Looks like everybody's tuning out. I appreciate all you guys. I'll see you guys next Tuesday. Titan Talk Tuesday with me, John, CEO and founder of Titan.